It's Studio 10 Live, your source for entertainment, lifestyles, and fun.
All right, well, it is no secret. Something a lot of women and men look into as they age are different forms of facial plastic surgery, particularly eye lifts and neck lifts.
And today we have Dr. Dominic Castellano.
Close enough.
Close enough.
Castellano.
The Florida ENT and Allergy, here to discuss a few of these options. So this is great for men and women.
For men and women. Let's start with eyelid surgery because I feel like I'm seeing more of this out there today.
So you're referring to what's called an upper lid blepharoplasty.
Okay.
And it just involves addressing excess skin in the upper eyes or some of the excess fat. And, you know, as we age, we start to get laxity. And so sometimes the fat starts to come forward and you need to remove some of that fat. And then obviously the skin starts to become an issue as well.
Now, how exactly is this surgery done?
So with an upper lid blepharoplasty, you can make an incision in a natural crease that we all have. And the reason why you put it there is you want to hide that incision so that way when it heals up, it's not
you don't want to see the
perceptible.
scars.
Right. I mean, let's face it, everybody wants to look more refreshed and feel better, but they don't want people to know.
Right.
So, you know, it's about camouflaging
Being
things.
discreet with your plastic surgery, right?
Sure, absolutely.
Now,
absolutely.
I've seen people get addicted to, once they have this look and they keep going and going, what is the actual cost of operations like this?
Well, it just depends. I mean, it depends how many you do, what you do, and, you know, it could start in several thousands of dollars and go up there.
Right.
I mean, the deal with the majority of the surgeries we do requires, you know, surgeons, it requires anesthesia personnel, requires nurses, requires supplies, and all those things kind of add up. And you want to do things in a safe fashion so that way things are done the correct way.
Right. You talk about being doing things the safe way. Who is an actual candidate to properly do the surgery and be healthy?
Sure. Anybody who is over the age of, let's say, 20 years old is somebody who could technically have surgery from a aging face standpoint. It's normally not done in people who are that young, though. You know, it's normally people who in their 40s and on.
Oh, sure.
And then the younger people are going to be the ones who need something done to their nose or their ears or something along that
Or
line.
forehead wrinkles?
Forehead wrinkles.
I got some forehead wrinkles,
No, we have some pictures we want to show, but he wants to know about his forehead wrinkles. Is that a thing?
He looks great.
I told you. Right, right. All right, so let's bring these pictures back up. You've got some pictures.
Sure.
What are we looking at here?
Sure. So the pictures are basically showing women with aging changes, and what they want to have improvement on is their neckline, their jawline, and this is just illustrating what a facelift can do, a neck lift can do, and really what you're trying to do is reestablish the neckline and the jawline with the face and neck lift.
Are you seeing more neck lifts these days? Because I feel like I'm hearing about them more.
I am, and part of it, more men are getting things done these days, and so that's kind of feeding into addressing the neck area. And in particular with the neck area, you're really talking about this middle region.
Right.
And when you start delving into the facelift part, then you start talking about the lower face and trying to readdress the jawline and recreate that to give it a more youthful appearance.
Now, when people get these surgeries, what is the likelihood of the neck growing back?
So with a neck lift, when you address the central area, you're addressing fat, and then you're also addressing muscle laxity. So from a muscle laxity standpoint, that's what you're trying to tighten up with a neck lift. So as long as people take care of themselves, work out, exercise, those procedures are going to last years. Right. The likelihood of the fat coming back is pretty unlikely, because as long as with the liposuction you're removing those fat cells. Now I don't control how people maintain their weight thereafter, so you can certainly gain it back.
Right.
But if you maintain an active lifestyle, it shouldn't come back.
All right, sounds good. Some very good tips in there. Thank you so much for sharing them with them. If you guys are interested in plastic surgery options dealing with the eyelids or neck lifts, you can find more information at the website that you see right there on your screen, FloridaENT and Allergy.com.
All right.